For decades, veterinary dentistry was treated as a side task, a quick cleaning squeezed in between surgeries. But we all know that scraping tartar isn't the same as treating the patient. What if the biggest bottleneck in your dental suite isn't the equipment, but the one holding the instruments? Welcome back to the Veterinary Business Podcast. I'm your host, Dan Disha. To help us navigate this shift, we are joined by Mary Berg. Mary is the president of Beyond the Crown Veterinary Education. She is a charter member of the Academy of Veterinary Dental Technicians and a rare hybrid in our industry, combining over a decade of high-level research with practical, in-the-trenches, clinical application. She is currently leading a charge to move dentistry from a loss leader to a primary revenue center, teaching practices how to utilize their technicians to the full extent of their license. Today, we are discussing raising the standard. We are talking about why dentistry requires a team approach, how to operationalize your workflow to reduce burnout, and how to build a dental program that is both clinically excellent and financially sustainable. This episode is brought to you by the Veterinary Business Institute. If your practice is looking to grow or optimize its services but isn't sure where to start, we're offering a complimentary marketing strategy meeting with Laila, a veterinary marketing strategist who's helped hundreds of clinics grow with clarity and confidence. In this complimentary session, you'll receive a review of your current online presence and a 6-month growth roadmap tailored just for your practice. You can book now at www.veterinarybussiness.com/MSM. With that being said, Mary, welcome to the Veterinary Business Podcast. It's great to have you here.
Well, thank you for having me. I appreciate that.
Now let's get to work. Mary, you focus a lot on team-based dental training. Why is it so important to involve the entire team beyond just the veterinarians when improving dental care in a practice?
Well, dentistry is a team sport. There's no way around that. Everybody on the team has to understand the value of dentistry and how important it is to the pet's overall well-being. And we also have to understand the importance of having these regular dental procedures done on our patients so that they can actually have a longer, healthier life. So that includes everybody from the front office or the CSRs all the way to kennel, if you are still a hospital that boards pets. We really need to have them understand that a good oral cavity can actually add a couple years to a pet's life. So having everybody on board really makes a difference on making sure that the pet owner understands the value and they see the cohesiveness of the team and understand that this is something important. The whole team is really into this because, if you have a veterinarian who really likes dentistry, but the rest of the team doesn't really get it, that's going to transmit to the pet owner in some way, and that procedure might not get done for the pet. So it is important that we have everybody from front to back in the hospital understanding the value of good oral health for the patient.
Now, you mentioned that fear of anesthesia is a major client barrier. How does training the front desk staff on anesthesia safety change the conversion rate for dental bookings?
Well, I think everybody has to understand, first of all, that there is always a risk with anesthesia. So I don't want to come off and say that this is, it's really 100% safe. However, I really encourage hospitals to have the conversation with their teams about what we're doing at this hospital to ensure that your pet will be as safe as possible under anesthesia. So that includes, pre-anesthetic blood work, which I like to rename surgical safety blood work, because I think that just puts a little bit more fuzzy for the pet owner to feel a little bit more secure. Not that it's still not a risk, but we still have to have that explanation to them. But that, we have to explain why the anesthesia is important, because our pets don't, lay still and open wide and say, So we have to go in and have that patient under anesthesia. And we also have to understand that the majority of dental disease is below the gum line. So just cleaning plaque or tartar off of the crowns is not going to treat the disease. And we have to where the patient is, asleep to do that. I mean, we can sit there in our office, in our dental office, and just kind of open our mouth and, maybe grip the chair a little bit, but we're not, having to be asleep. Where our pets don't understand what's really happening. But it is important that everybody understands what the hospital does to ensure the safety. I think one of the biggest things that I encourage all hospitals to really make sure they're doing and incorporate is a dedicated anesthetist for every dental cleaning. Back years ago, it was something that was just done by the technician doing the cleaning, and they were expected to monitor the anesthesia at the same time, and you just can't. I can multitask with the best of them, but sometimes that's something I really can't do. And I want to have my pet owners feel secure. I want them to know that somebody is going to be dedicated to monitoring that patient the entire time it's under anesthesia and into recovery. So I think it's really important that we have clinics really understand that we have to have that dedicated anesthetist to make sure the procedure is going to go safely, but also having that person shortens the procedure, because then the person who's doing the cleaning isn't stopping every 5 minutes to get a set of vitals. And that can add 30 to 40 minutes to a procedure. So keeping that anesthetic period shorter. I'm going to tell you right now, the days of the 30-minute dental cleanings are long gone. We have to take the time to look for disease, but sometimes when we don't have that person helping us and watching our patient for us, it can add more time to the procedure.
Right. And you've spent over a decade in research and then transitioned into practice management and dental education. So, Mary, what are some of the lessons that come from your research experience that have the biggest impact on how clinics deliver dental care today?
Okay. And just to clarify, I'm actually still doing research. I just don't do it full time anymore. So I'm still involved very heavily with consulting with companies to help them design protocols and products and testing methods, for their products. But I think what really is so important is there is not a lot of control over what is put on veterinary dental products out there in the world. We have a lot of control over diets and some treats, but we don't have anything on other types of products. And that can be super misleading to our pet owners. They need to know what's safe. And sometimes just having veterinary recommended on it isn't necessarily a good thing, because it's probably not a really safe product anyway. So we want to make sure it's something that has solid research behind it, that it's actually going to do the job it says it's going to do. So I am going to, put a shout out for the Veterinary Oral Health Council seal of approval, the VOHC seal of approval, that gives a seal whether the product works to produce or to reduce tartar or reduce plaque or both. Although, there are good products out there that do not have the VOHC seal. And I'm never going to say, oh gosh, only use products on the VOHC, because there's really other good products out there. But you need to do your research as a veterinary professional to ask about that product, to say, what have you done? What studies have you done? Do you have a white paper? What have you done to actually prove that this actually works? Instead of, Joe Schmo said it works, so we're going to use this. And, there's those kinds of things that are I guess, guardrails for products that work. And sometimes we have, products that are brought into the veterinary market that were from human world. And, and it's like, yeah, that might work in a person, even though our mouths are very similar in the way plaque and calculus is formed and stuff. But it may work in a human, but that's probably not going to really work in a dog or cat. And we also want to make sure they're safe for our pet. Is the product too hard? Is it going to cause tooth fractures as opposed to actually helping clean the teeth? Is it going to potentially cause a foreign body? We have all those kinds of things that we have to take into effect when we're looking into recommending good products. I also, when I go into hospitals, I do kind of say, don't just hand them a print off of all the VOHC products. Because I think that's overwhelming. There's over 77 products for dogs and 18 for cats right now. And that can be really overwhelming for a pet owner. Pick the ones that your hospital really knows work And those are the ones that you're going to kind of highlight for them. And then also, after you've had that first visit about home care, then have them come back in a week or two and just find out how it's going. And if the product isn't working for the pet and they don't like it or whatever, you can offer them other options. So that actually helps bond that pet owner to the hospital then too, because now the hospital or the pet owner knows the hospital cares. And we want to do what's in the best interest, because the old adage is nobody cares how much you know until they know how much you care. So, that's kind of my thought on most products.
Okay, that's wonderful. I mean, that's pretty much getting back to the basics and really caring for your client.
Yeah.
Now, Mary, many practices struggle to integrate dental programs without disrupting the daily workflow. What are some of the strategies or tips you could recommend for implementing dental protocols that are effective and sustainable?
Well, I think part of it is understanding how to evaluate the oral cavity before the dental cleaning, how to do a good conscious exam on a pet in the exam room. And I actually always recommend that clinics price their dental procedures based on the degree of periodontal disease in the mouth. And we had, in my hospital, we had 4 prices for dogs and 4 for cats. The cats were just a little less expensive because they only had 30 teeth versus 42 teeth. And it wasn't a big difference. But I always recommend to try to keep that stage 1 and 2 as low as the hospital can go financially, to encourage more people to come in early, because it's a shorter anesthetic process. It's better for the pet. It's preventative. Well, they still have disease, but it's more preventative than waiting till we have that kind of dumpster fire mouth, right? So I recommend doing that, but I also recommend using those stages to schedule your procedures. So I never recommend a hospital scheduling more than 2 to 4 dental cleanings a day or cohats a day. And that's going to depend on what degree of disease I have. So that's per table. So if you have only 1 dental table, 1 technician, 2 to 4. And that means I will easily do 4 grade 1 or 2s in a day, but only 1 or 2 grade 3 or 4s. Because if you look at how to schedule them, I schedule an hour for a grade 1. We may not take a full hour, but by the time we take radiographs and everything else, that's getting close to the hour. And we always find something. I'm not going to lie. It just happens. And then a 2 is about an hour and a half. A stage 3, I'm going to go ahead and do that for about 2 hours. And as we kind of cut it off at 3 hours at a grade 4. And then if it takes longer than a grade 4, if the anesthesia is going well, you can go longer than the 3 hours as long as the anesthesia is safe. But that's kind of my cutoff for scheduling. And that way we are not cutting short what we need to do for the patient. And, if I had 4 grade 4s in one day, which is 3 hours a piece, that's 12 hours of work. And, you're probably going to think, oh my gosh, I'm really tired. I'm going to start cutting some corners here. We can't do that. We really need to make sure we're doing everything we need to make sure that we're looking for disease and we're taking the time to treat what we find. So that's kind of my philosophy on how to make sure you schedule appropriately. Also, creating those treatment plans, like kind of a canned treatment plan that has everything included, except extractions or, kind of treatments like that, because those have to be added on. But then, I always kind of joked with my doctors that, if they came out and told me it was a grade 2, we put a grade 3 on our treatment plan. Not that I didn't trust my doctors, but you can only see so much in that mouth on a conscious exam. And that way it gave us a little cushion. And we explained that to the pet owner, that we thought we were going to be high on this, but it's a living animal. I'm not going to know what's in there till I have them sedated. And hopefully we come in under the treatment plan. But having that kind of structure and scheduling for a hospital can really help alleviate that, oh gosh, now I have an oral nasal fistula to repair, or whatever the case might be. And it throws a wrench into the whole day schedule. But I think it's just coming up with that philosophy. This is how we're going to do it. Or some hospitals just we're going to do dentistry on Tuesdays and Thursdays, something to that effect. to make sure that they're doing the job appropriately.
Got it. Now, how can investing in dental training and improving your team's dental skills contribute not just to better patient outcomes, but also to the overall financial health and growth of a practice?
Well, I think when you have your team well trained and everybody understands how to do the procedures, to do them efficiently and effectively, it is just going to improve your efficacy and your efficiency in the procedure. So whether or not that's using the right instrument in the right part of the mouth or the right scalar tip in the right part of the mouth, some time saving things. I see a lot of things in hospitals that I'm like, okay, I'm not an efficiency expert by any stretch of imagination, but if you change it and do it this way, you've actually cut down, 5 minutes off this procedure because now you're not having to, go back and fill the prophy cup every time. Little things like that can make a huge difference. And I think a lot of times it's hospitals are still, we're getting better about dental training in schools. But still a lot of hospitals are like, well, I was trained by, somebody who'd done it for 20 years and now they've trained me how they do it. And there's better ways to do things. And I think making sure that your team is on the cusp of what really is going to be the most efficient way, but also the safest way for the pet. And that can include, doing a better job for the patient and then maybe even be more efficient and get that extra procedure in a day if you need to. But having everybody trained and everybody understanding what tool is used where, how it's used efficiently. And, you mentioned earlier in the introduction about not just, having the tools aren't as important as people, but the tools are important. And you have to have equipment that is reliable and safe and is going to work the way it's supposed to be. So having good equipment is also very important. If you have a X-ray machine, you're taking dental X-rays, and the sensor, glitches out every third X-ray. That's not efficient, So you have to have equipment that's going to work to do the job efficiently.
Let's talk a little bit about that X-ray actually. So many owners do see the dental X-ray equipment as a cost, right? So can you walk us through the ROI? How quickly does a well-trained technician pay off that machine?
Okay, so I've always used this, and I know these numbers aren't quite accurate anymore. So, but it's for easy math because it's early in the morning, and I don't want to have to think too hard today. But let's say you purchased a dental system, X-ray system, or a radiology system that is, and I know this is really cheap right now, but let's say $15,000 for the generator, the sensor, and potentially the computer. Okay. And if you did 10 procedures a week, okay, and even if you only added and increased the cost of the procedure, but let's just make it really simple math, $50, okay, that's $500 a week you are making just on the radiographs, okay? And if you did that for 50 weeks a year, because I'm that nice person who gives you 2 weeks vacation, wink, wink, that's $25,000 you've made in a year just taking the radiographs. That doesn't include the 30 to 40% more pathology you find in those radiographs that you can now, treat and have extra income from that as well. So you can technically pay that machine off in, like I said, this is simple math, but, 7 or 8 months, it can be paid off, but you have to use it. If you don't use it and you don't invest in the training for your team, and everybody is frustrated because taking dental X-rays is not intuitive, and they're struggling and they're trying to do oh my gosh, I can't get this. How do I get that X-ray? And they're not getting the apex of the root, or they're not understanding how to correct the image. You're not gaining anything, and you're not doing the patients any justice either. So investing in training on how to take a full series of X-rays on a dog and a cat can be valuable for your team. And it can be eventually more efficient. I never give a time frame of how long it should take to take a set of dental X-rays because I think that's unfair. I know what I can take them in, but that's unfair for somebody who's new at it. But the more you take every single patient every time, the faster and more efficient that procedure comes. Part of the radiographs become for that patient or for that technician. So I think it's also important that not only do you learn how to get good dental x-rays, diagnostic dental x-rays, but also then having the veterinarian trained on how to read them, how to interpret them efficiently. Don't just rely on what you've heard or read in a textbook a while ago or understand, because there's a lot of things that I hear vets tell me that I can't read that because I can't see this on the x-ray. And I'm like, can you see the apex of the root and can you see the alveolar bone? Well, yeah. Then you have a diagnostic x-ray. Okay. Yeah, it's nice if you can see this, but for that survey x-ray, we're just looking to see if something's going on below the gum line. And if you have the doctor who's like, well, I just don't like that angle. Can you take this again? And you're taking 10 x-rays and it's like, that's not helping anybody really. And I understand that, but all the stuff when I talk about x-rays, and I'm talking about what's diagnostic with what's not diagnostic and how to get, rads that can be read quickly. All that information is coming from diplomate friends of mine. It's not just me being like, oh, yeah, that's good enough. But it's like, yeah, we can see what we need to see. Let's move on. And then if it is something that could be a potential issue, then we might have to take another rad or two. But, getting those full series, and my motto is all the rads in as few, all the teeth in as few x-rays as possible. Let's get through there and get them done, knock it out. And, teaching the team, but you have to have your team trained. Don't expect them to just know, because it's not intuitive to take dental x-rays.
Absolutely. Now, can we talk a little bit about the pricing model and how we could fix it? Because we see that many clinics are undercharging for their dentistry because they're afraid of the sticker shock. How do you coach teams to present high value estimates confidently?
Well, actually, I'm doing a talk next week on that, but it really becomes kind of an art to present a treatment plan. And I don't like just emailing a treatment plan to a client or just handing them a piece of paper and say, here's the treatment plan. It's going to include anesthesia and the dental cleaning and whatever, because that doesn't help you out. Okay. Especially when that price is, and prices are getting higher and higher and higher. So we have to really understand how to be kind of on the same playing field as our pet owners are. And by that, I mean, I'm not going to stand over my table and talk about a treatment plan. I'm going to sit down beside my client. Okay. I'm going to talk to them about it. And I will go through every step of that treatment plan so they understand, why do I have to have a pre-anesthetic? Why do I need an IV catheter? Why do I need to take rads? Why do I need to do this? And then at the end of that, then they understand now, okay, so there's a lot of steps involved. There's a lot of things they have to do. And I understand now why it's costing a bit more. Okay. One little tip that I've used for years and it works really well. I've gotten caught a couple times by somebody, but what I do is, as I'm going through that treatment plan, I have my hand on the bottom number, of the bottom of the total cost of the treatment plan. So when they're looking at it, they're paying attention to me. And then, because if they see that number first, they're like, yeah, you're talking about sticker shock. Like, they're like, oh my God, I didn't know. But now that they understand every step that's involved and why everything is important, that bottom number doesn't seem as high. So it really comes down to in my book, pricing your procedures fairly. And I see some clinics that are like, ooh, that's pretty pricey. Are you doing a good job for that? Or are you just trying to keep up with the, clinics in town? But make sure that your team is trained well and you're doing a good job to earn that price that you're charging for that procedure. And dentistry has been historically under 10% of the revenue from hospitals across the country. But when 80 to 90% of our patients have this disease, to me, that is sad that it's only still under 10%. So I would, be ecstatic when we start getting to where dentistry is like 20 to 30% or even higher of the general practice practices out there, because it is something we can do in general practice. And, granted, there's procedures we shouldn't do in general practice that we need to refer out. But for the general dental cleaning and cohats, we have to know how to do it efficiently, how to do it effectively, and how to price efficiently for that. But also, it should be some of our income coming in. I had a client one time who came to me and he goes, a veterinarian, he had me come into his hospital and he goes, Mary, I'm not doing spay and neuters like I used to. That was kind of my bread and butter in my practice. And he brought me out to help his team improve their dentistry, because he goes, my patients all have this. Why haven't I been doing this before? And I'm kind of like, you're going to be my poster child, because now you understand that, yeah, we aren't getting the income we used to do. What can I do better and do effectively so I'm doing a good job, not just, popping like you said, popping the tartar off the crown of the tooth, but going below the gum line, looking for the disease and treating the patient efficiently, and having that become a profit center for our practice.
Wonderful. And now looking ahead, Mary, what do you see as the biggest opportunities for practices to elevate their dental care? And how can veterinary technicians and team leaders play a key role in shaping that future?
Well, I think having good equipment, having the equipment you need. I still hear hospitals that don't have dental radiographs. I still think, there's hospitals out there who talk to me about, well, we're just going to get a CT scanner in. And I'm like, you still need rads. Okay. You still need dental x-rays. That CT scanner is great. That cone beam is great, but you still need to have a rad sometimes to see what's happening. So it's not a one or the other. But I think part of it is just really taking the time to make sure your team is well trained and utilizing your technicians. And by that, I mean, the technician should be doing majority of what's happening in the dental suite, with the exception of diagnosing and oral surgery. Oral surgery is extractions, and that's altering the body. So I'm a huge believer that there's a few states that allow technicians to do extractions. And I'm always like kind of nervous about that, because sometimes that's taken to, oh, we're going to remove bone now. And now that becomes an orthopedic surgery. That is no longer a dental procedure. So having the technicians trained within the scope of their practice. And then if they are having to do the extractions in those states, are they being compensated for that? Or is the veterinarian being compensated? And does the client know who's doing the procedure? Because that can be an issue too. So I want to just make sure that we are using our technicians to what they can do and what they should do. And that means that, I believe that a technician can do all the client education, getting that pet owner to understand the value of the cleaning, and how to present the treatment plan. They can do all the charting, the oral exams, all the rads. The doctor can then go in and interpret the radiographs, and then also look at the chart. And if there's an area they're concerned about, they go back in and kind of check that area. It's just like going to your dentist. Your hygienist does all that work, and your doctor comes in and just, sees you for a couple minutes and might check a concerned area. And then the technician is also then going to do the home care and going to do the discharge appointment and talk about aftercare and talk about what products can be used in the oral cavity to help that patient out. When the technician takes all that load off of the veterinarian, they can then be seeing other patients during that entire time, instead of having to, do the discharge and do all that. And, it is just something. Now, there's occasionally times when the vet should do the discharge if it's maybe not a good diagnosis. But for the most part, this can be a totally technician-driven part of the veterinary team in the veterinary hospital.
How does specializing in dentistry help a veterinary technician stay in the profession longer?
Well, any specialty, and just I want to clarify that you don't need to be a VTS, veterinary technician specialist, to do well in this profession. Okay, just want to state that. But if you have something that you are truly passionate about in your hospital, and whether that's dentistry, whether that's behavior, nutrition, there's 16 specialties out there now. And that's where you're truly passionate about. Then, look into becoming a specialist in it, because when you are doing something every day that you enjoy and that you want to do every day, it does help you stay engaged in the profession longer. I always tell that when I was a practice manager, we had 4 RBTs in our clinic, and obviously the dental one, I like the teeth. That was fine with me. I had one who was really good on cats and exotics, and I had one who really liked internal medicine, and I had another one who really liked orthopedics. So we funneled those appointments to those technicians if we could, because we knew that A, they were going to do a better job, and B, it was what they wanted to do, and they enjoyed their career that way, and they stayed longer. Now, granted, we all could do pretty much anything we had to. You didn't really want me talking about diabetes to a pet owner. I could, but I'd rather talk about the teeth. But it's something that if you are a technician and there's something you really just truly enjoy, and you're really passionate about it, have that conversation with your managers and your owners and say, this is something I really want to do, or I really want to show you, and then come up with a plan on how you can do this in your hospital to potentially even bring more value into the practice. So I'm always like, there's always something out there. And granted, being a technician's tough. I'm not going to ever lie about that. I mean, the average career span of a technician is 5 to 7 years. And I think part of that is because we don't value them enough in hospitals. We don't value the training of a credentialed veterinary technician has gone through. We're not utilizing them for the fullest. And we're, not kind of helping them out with what they are interested in, So I think those kinds of things, when we do that in a hospital, our team members will stay longer and enjoy it. Some of us didn't get the memo about the 5 to 7 years because I'm now in it for 34 years. So, but yeah, it is something that you really find what you're truly passionate about. And then my other advice for technicians too is to never say no to an opportunity, even if it scares your pants off. Just be like, you know what? I wouldn't be doing what I do now had I said no a few times. And yeah, there's still days I'm like, what in the world am I doing? But just take that chance, and you don't know where it leads you and what you can do if you just take the opportunity to say, yeah, I'm going to give that a shot and see what happens with it.
Wonderful. Now, Mary, thank you so much for this insightful and absolutely practical conversation.
Thank you for having me. I truly appreciate it.
To our listeners, thank you for spending this time with us. Whether you're a practice owner, manager, or veterinary team member looking to strengthen your dental program, we hope today's episode gave you actionable insights and inspiration to raise the standard of care in your practice. If Mary's approach resonated with you, I encourage you to explore the work she's doing through Beyond the Crown Veterinary Education, where entire veterinary teams are trained in practical, sustainable dental protocols that improve patient care, team confidence, and operational success. And before we wrap up, a quick reminder, you can still book a complimentary marketing strategy meeting with Lila, where you'll receive a personalized review of your clinic's online presence and a 6-month growth roadmap tailored just to your goals. Visit www.veterinarybusinessinstitute.com/MSM. From all of us here at the Veterinary Business Podcast, thank you for showing up, investing in your team, and recognizing that strengthening your people and processes is the key to stronger patient care and practice growth. Until next time, take care.